Hello, everyone. Thank you so much for joining us for the Navigating New Terrain, Keeping Up to Date with Evolving Vaccine Guidance panel. My name is Emily Noodleman. I use she, her pronouns, and I'm the Director of Implementation and Outreach at the BRIE Collaborative. We are so excited to have you here. As we know, this topic has a lot of energy behind it. We've seen over the past year, long-standing vaccine recommendations and guidelines have undergone some notable shifts, changes that have introduced some uncertainty for clinicians, health plans, and communities alike. When trusted sources updates their guidance, it can really spark confusion and raise important questions and prompt organizations to reassess what adjustments are appropriate or even necessary in their practice. Today, we are very fortunate to have leaders from across Washington state who will share how they are navigating this evolving landscape. Our panelists will offer insights into how their organizations are interpreting emerging information and deciding when and how to adapt any clinical or operational approaches and communicating these updates clearly and confidently for patients, clients, and provider networks alike. The intent of the discussion today is really to explore how clinicians, health plans, and again, those community partners can continue to lead with science and evidence-based information when making decisions about care. We'll focus on how to clearly and respectfully communicate that information to patients and their families so they can make informed decisions about whether to receive the recommended care. An important part of this conversation is ensuring access. This includes maintaining physical access to vaccines for those who are able and eligible to receive them, as well as addressing affordability so cost is not a barrier to care. We begin from the shared assumption that individuals and families want the best possible health outcomes for themselves and their loved ones. And our role in the healthcare field and public health professionals is to really support them providing accurate, up-to-date information, answering questions transparently, and ensuring that recommended care remains accessible. In this session, we'll explore how we can support individuals and families in accessing this care that they want and that is recommended for them while respecting the patient choice, maintaining trust, and staying grounded in the best available evidence. We'll have an opportunity for a Q&A with our speakers. At the bottom of your screen, you should see a Q&A box. Please place any questions there so we may review and ask them on your behalf. The webinar is being recorded today. We plan to send out the recording after this event. This topic of immunizations is very important to the BRIE Collaborative. It was brought forward by one of our members to talk about and just see what is happening in this evolving space. So we're really grateful for all of you to join us today and learn more from our speakers. Our speakers today are Dr. Frank Bell, who is a pediatric infectious disease physician, Jessica Beach, who's the Director of Health Equity and Cultural Competency at Molina Healthcare, Dr. Kiss, who's a pediatrician at UW Medicine Primary Care, Dr. Christina Petsas, who's the Chief Medical Officer of Quality and Compliance at United Healthcare, and Michelle Roberts, the Assistant Secretary to the Washington State Department of Health. We will now jump into the panel, and I'm going to invite my panelists forward, and we'll just start asking them to share their name, organization, and how in your role do you work with vaccines. And I'll start with Dr. Bell.
Good afternoon, everybody. As Emily said, I work primarily as a pediatric infectious disease physician with Swedish System. My name is Frank Bell. I'm really here in part today because of my role with the Washington chapter of the American Academy of Pediatrics, and hopefully some insight as to how National AAP has been helping out with these difficult times.
Thank you. Dr. Kiss?
Good afternoon, everybody. Doreen Kish. I'm a primary care pediatrician. I've been with UW Medicine for the last, I think, 18 years. So I practice in clinic with patients, and I also have a role in pediatrics, population health, and quality work for my primary care organization.
Jessica.
Hi, everyone. My name is Jessica Beach, and I'm the Director for Health Equity with Molina. How I work with vaccines is probably different from the others on the panel in that I really intersect them most from a member perspective and how we educate our members about access to vaccines, how we educate providers about updates and things like that.
Dr. Patsas?
Good afternoon, everyone. Christina Petsas. I am a board-certified family medicine primary care physician, and I am also the Chief Medical Officer for United Healthcare Commercial Line of Business in Washington. And in my role, whether in clinical practice or as the carrier, I try to reduce barriers to safe, effective, and affordable treatments for our members and continue to support the conversations that our frontline clinicians are having with our members in order to drive better outcome for all.
Michelle.
Good afternoon, everybody. My name is Michelle Roberts. I use she, her pronouns, and I serve as the Assistant Secretary for the Prevention and Community Health Division at the Washington State Department of Health. And immunizations is one of the offices in our division, along with maternal and child health programs, WIC, and some other family programs that impact families and communities. In this role, I have a lot of work to help ensure that the state has a strong public health infrastructure in partnership with providers, including the childhood vaccine program that purchases and distributes all the recommended vaccines for all children. And obviously, we've been really active with many different partners on the immunization policy space and working to really ensure that Washington State's immunization policy is still grounded and guided by science.
Thank you all for being with us today. Dr. Kiss, I want to start with you. So, and as I started with my own introduction, I shared my role here, but my background is I'm a nurse and I'm also a parent to young children. And it is confusing out there right now with the changes happening, the rapid, how quickly they are occurring, and just ensuring that you're doing the right thing. As a clinician, how are you managing changes from previously well-accepted and credible sources and ensuring your patients and their families receive accurate and current information?
It is a very confusing environment right now for families. There's no question about it. I think what we've done at UW Medicine is we haven't changed. We are still making the same recommendations, still having the same discussions that we did 2 years ago. Super grateful to the state of Washington and the West Coast Health Alliance for just continuing the same vaccine schedule, making these vaccines available, and not an out-of-pocket expense for families who are trying to pick and choose. How it works in primary care. This is a big part of the discussion at every single well child. I have to say it's taking up more and more of the well child because this conversation comes up very, very frequently. We have families who are totally on board. Yep, we want everything, no questions. We have families who question every single vaccine and do we really need it? So it's one family at a time. And then, I mean, this is what we do in primary care. You build relationships and you see them again and again and again, and maybe hesitant the first time, but maybe the second time they're thinking about one or two, and you just kind of work from there.
Can I ask you a follow-up to that? Is previously we're like, oh, this is the CDC's recommendation, and then that has changed. And so it can be confusing when the source that everybody used to turn to is now not the source to turn to. And now there's a new source, and just now that's can be hard to be palatable to a person when with all those changes. Are you doing, or how do you approach messaging to your families when the scientific consensus is kind of changing with these different authorities? Are you noticing or needing to change anything in your practice?
Not significantly, to be honest. I do work with a lot of immigrant families. I'm not sure how closely they're paying attention to who's recommending what. They're just kind of hearing that things are being questioned and they're looking to us for answers. What is safe? What do you recommend? So I don't have a lot of discussions about the different recommendations, but more just what do I recommend? And then we go forward from there.
Thank you for that.
Emily, I don't know about the other panelists, but I can't hear
Can't
you.
hear
I can
you.
see you talking, but it sounds muffled.
Okay, 1 second. Can you hear me?
No.
Okay, 1 second. Oh.
Hi, everyone. This is Beth. I'm from the Bree Collaborative. I am the backup plan, to kind of step in and help ask some of the questions. So I think this question is for Dr. Bell and Michelle as part of the state's vaccine advisory committee. What processes or criteria are you using to evaluate new or conflicting guidance from federal, state, or professional bodies to determine whether practice changes are needed, and then disseminate those updates across your networks?
You want to
Michelle,
start?
would you like to go first?
Sure. I mean, I'll say we're really looking pretty comprehensively at the data and looking to national organizations who are continuing really comprehensive reviews of the science and the data. So that includes the Vaccine Integrity Project, it includes the American Academy of Pediatrics, it includes national other associations who continue to do a deep review with the science, and like with when every year with COVID, continuing to look at what new studies may be and what's happening. We're deeply committed to making sure our policies in Washington State are driven by the best available science. So that's why we've joined with the the West Coast Health Alliance to ensure that there's strength in the group of states looking at the science. We see East Coast states doing a similar thing as well, but just really wanting to align. We're continuing to use committees like our Vaccine Advisory Committee to give us input, to help know us. Also, some more sets of eyes on what the data is, what's the science showing, and then what our vaccine recommendations are. So, and really continuing to now put out our own vaccine recommendations now that we can't rely on the CDC to be driven by science-driven policy in their vaccine recommendations. So, and that will continue. I'm super happy to report that the governor and the Office of the Insurance Commissioner, or the Insurance Commissioner, had request legislation that has passed both houses, the Preventative Services Bill that really kind of enshrines how we're going to continue to do this in Washington, and delinks our state policies both around what vaccines are part of our childhood vaccine program and what drives insurance coverage in our state, changing them from being linked to the federal ACIP recommendations to being linked to recommendations from the Department of Health. And so that has passed and is expected to be signed by the governor in the coming days. So really thrilled about charting a pathway to ensure good science behind our policy decisions as a state. But I'll turn it to Dr. Bell now, who can speak probably some from one of the providers who is actively involved in giving the department input.
I think, Michelle, your broad overview is really helpful because it's true, this is confusing. And in the absence of a single body, the CDC producing recommendations, the FDA approving vaccines, and the ACIP making recommendations, there's a whole host of people who are, committed to this and interested. And it's really difficult to know how to pass out the, maybe subtle differences between approaches between the West Coast Health Alliance, our Department of Health, what the AAP is saying, what the American Academy of Family Physicians is saying. But I think, there's a simple answer to all of this, which is really to come back what Dr. Kiss was saying, is that, essentially right now, for us as practicing providers in this state, nothing has changed. The environment is extraordinarily confusing, and that's just not limited to vaccines. We've had seed oil and beef tallow and acetaminophen dragged into the fray, with all sorts of implications for mental health and for the well-being and development of young children. But right now, I think we're very fortunate to work in this state with universal purchase, with the Department of Health that is lockstep with scientific advice, with the governor that also is paying attention to this, Secretary of Health, and these other medical organizations, including, but certainly not limited to, the American Academy of Pediatrics, have also committed to, looking at the science, where questions are raised, to not dismiss them as, irrelevant, but to, stress the process by which we evaluate new information or new concerns. And to say that really of the changes, of which there have been many in the last 12 months, none have been driven by important new data. So we come back to the science, and of course, science is not one thing to everybody. But I think, we have others, Michelle, you mentioned the Vaccine Integrity Project, the CIDRAP, the Centers for Infectious Disease Research and Policy from the University of Minnesota. So there are other bodies who are trying to step in to fill what really is an enormous gap left by the CDC. And there are folks at the CDC who are still, at their desk doing their job. The echelons above them are making it extraordinarily difficult for them to work. But we have partners there too in academia. Great that we have payers too who have committed to what they know to be important for the health of children to continue to provide insurance and to make sure there isn't an obstacle to provision of vaccines. It's really important for all of us to preserve availability and affordability for vaccines.
Thank you. I want to bring the health plan perspective in, but before I move to that, Michelle, there's a comment or a question that came through. Is there going to be an official announcement from the state stating what immunization schedule VFC enrolled providers should follow? This individual says they've not seen anything to that impact yet.
Yeah, no, we can make sure we're following up. Happy to follow up with this person if they give us their contact information as well specifically. But the department has been sharing that we recommend the AAP schedule as the official schedule. That is what our recommendations are. That's been an endorsement of the West Coast Health Alliance as well. So we do strongly recommend that providers and families are vaccinating according to the new AAP recommended childhood immunization schedule.
Thank you for that. Jessica and Dr. Petzes, from the health plan perspective, what processes or criteria are you using to evaluate this new and conflicting guidance? Is there any federal, state, or professional bodies that you kind of look at to determine whether coverage changes are needed and then disseminate those updates across your networks and letting your staff know too?
Dr. Petzes, do you want to go first or?
You can go ahead, Jessica.
Yeah, sure. So I think speaking from a Molina perspective, we start with Washington specific guidance. So it was great, hearing the comments from Dr. Roberts earlier. We start with Washington specific guidance. We really lean into what the Department of Health is sharing, what their updates are, what HCA is sharing with us. And then we assess kind of the clinical consensus, operational impact, and member experience that ties to all of those things, and then use that to move to the next step. We try to be really intentional about not over communicating changes that don't affect access. So I think that, everyone has shared below, right? Like the bottom line is that trust is really important. Nothing has changed with recommendations to date. And so I think that's what we're really trying to navigate is how do we limit confusion within our membership and encourage them to lean into their trusted relationship with their primary care provider to have those really critical and important conversations that they're having all of the time. And so we think that approach helps to maintain stability. It ensures that providers can focus on patient care rather than navigating the conflicting messages that are coming from all over the place. Yeah, thank you.
Yeah, I'll echo what Jessica has said. From a carrier perspective, there's absolutely no change, especially with the health plans in Washington, Oregon, Hawaii, and even California around vaccine coverage, both in our government lines of business and commercial insurance. The reason behind it is because whenever there's conflicting guidance, UHC does not simply look at the guidance itself. We do look at whether there is new data, new scientific evidence for this guidance. And to Dr. Bell's point earlier, there really hasn't been any science behind some of the conflicting guidance so far. So as such, there is no changes from a coverage perspective. Most of the vaccinations are being offered as no cost share to the members. And we're hoping that through communication with our membership that they will continue to see their primary care physician, whether it be family medicine or pediatrician, to obtain the right information around vaccination safety and necessity so that they can seek the treatment that will ultimately deliver better population health.
And can I clarify a point with that for the two of you is you represent children and adults. Right now we've been talking about following like the AAP recommendations. Are you saying coverage for both children like and adults regardless of the age of the populations, or are you focusing on one for all of the coverage?
That's a good question. I think that depends on, right now, I think there's a lot of changes in the pediatric vaccinations, right? Hep B, for example. However, I think that there is a long struggle with misinformation around vaccinations, as my own children are navigating, HPV vaccines, right? The necessity of it, the benefits of it. So overall, I would say that the approach to the changing guidance, regardless of the specific vaccine that is being discussed or recommended, or the opposite of that. The bottom line is that we need to look at the science and we need to look at the data. And if the change in guidance is not supported by science, then it is our recommendation to the plan sponsors to continue to offer these coverages. And so far, we've been very successful in communicating that to plan sponsors. And we are actively participating in various forums, such as the West Coast Health Alliance, to generate that coordination and alignment.
Thank you.
Yeah, and I can just add on from a Molina perspective, there's no change in the coverage for vaccinations for pediatric members or adult members. And I think where we are trying to focus is how do we make sure we're communicating that effectively and not causing more confusion? Because it's, how do we communicate with our members that nothing has changed, even though there's so much information swirling around that makes you think that something has changed, or the types of vaccinations my child is able to get or should get has changed, when the reality is, as has been said already, there are no changes. But really navigating that, who are the trusted messengers for our members? How do we make sure we're not over communicating or under communicating, and making it really clear that they have access to vaccinations, whether you're a child, it is your child, or yourself as an adult, that you still have access to these services and that they're safe.
Thank you. And I have one more question for the two of you, because I just want to clarify something on the call for those that are listening. Both of you represent health plans that have a national presence, but you both work in specifically Washington State. Is the information that you're sharing about coverage relevant to just Washington State or other locations in the country? Both for our own learning, but also there's some people on the call from outside of the state that I just wanted to clarify if you know that information.
Yeah, I think the approach is really similar in all of our Molina markets. From my original answer, right, we're always going to look at the partner closely with the state where we're serving Medicaid members. So I think all of the information that I've shared is really specific to Washington, but I can't say that it is like massively different from what we're seeing in other states. I think that that's something we're navigating in all of our markets right now, across the nation.
Yeah, I would second that as well. The strategy around preventative services benefits around immunization and vaccination is a regional and national strategy. And so far, while there may be some differences in practice styles in different parts of the country, from a coverage standpoint, there is no difference. We still want to offer that benefit to all the members should they want to receive the service.
Thank you. I just wanted to clarify that on the call today, so I appreciate that. I kind of want to shift. Let's talk about the communication of this is really hard, right? We've highlighted how the user, either the person receiving the vaccine or the parent deciding of the or guardian care person deciding about getting the vaccination for their child. It's hard out there with communication. Each of you have a unique opportunity to communicate to this audience of the Washingtonian, as a clinician, from the health plan perspective, or from the state. Can you elaborate, each of you, about how you're going about communicating vaccinations safely to your audience? Dr. Kiss, maybe we can start with you since you have that direct relationship.
Sure. In the clinic, we have a practice of we immunize every time you walk in the door if you're due. And even our medical assistants, as soon as a patient is being roomed, oh, I see you're due for such and such, and they can already order penned and they can actually give it if the family wants it on a delegated order. So we have a pretty efficient system of bringing it up every time people come. We can offer it right now if you want to have it. If you have questions, wait for your provider. But we discuss it a lot. Most families are interested in immunization. Most families move forward. When a family is hesitant, then the discussion has to begin. And the first question is why are they hesitant? And I'll be honest, it's usually fear. There's a fear that is being generated about all the side effects, which, I've been doing this for 30 years and I'm like, so how come I don't see all these side effects? Um, but they hear about it on social media, influencers. There is really a very negative national campaign going on right now about immunizations. And sort of our job is we're a little bit in defense mode. So tell me, what specifically are you afraid of? And that's been a moving target. It was, well, they cause autism. Well, guess what? They don't. This has been so effectively disproven. And as soon as it was disproven, it changed to mercury, thimerosal, and then that was removed from the vaccines. And then, well, okay, now we're going to say it's the aluminum. So, I mean, the target just keeps changing. And then the medical profession has to then do huge studies to disprove that there's any negative consequences of these issues that are brought up. And that takes time. So in the meantime, this is swirling around, especially in social media. So we're combating kind of a negativity towards vaccines. And what we have to do in the clinic is talk about how amazing they are. So we try to shift the conversation to let me tell you about these diseases we can protect your child from. And I've worked overseas. I've actually seen a lot of these diseases, and I can really describe them in intimate detail. And I think when people make decisions, it's fear of the vaccine versus you should have a healthy fear of these diseases we're trying to prevent. And do you know where you catch them? Do you know that tetanus is in the dirt in your backyard? It's not in a foreign country. Are you aware of how your kids can catch these diseases and what is the best way to protect them? So I tend to focus the conversation on what are their concerns. Yes, the science behind it, but I don't find that the science really moves people when they're embedded in fear. But I shift it to a conversation about protection and what things we can protect your child from. And I find very often I get some movement in that direction. And maybe the family doesn't want all the vaccines, but maybe tetanus and meningitis and, some of the more deadly ones we get some movement on. And then in primary care, we just keep seeing them back. We don't apologize for bringing up vaccines every time, even though they said no, thank you last time. And I tell families, if you keep coming to see me, I'm going to bring it up every time you come, and I'm not going to apologize because I want to give you the same standard of care that I would give any of my patients. And so they know they're going to hear about it. And over time, if they do some vaccines and nothing bad happened, there's more confidence, you get a few more done. And very often over the years, we can get most of them done. So, I mean, that's the superpower of primary care. It's longitudinal relationships, building trust. I tell them I vaccinated my own children. If I thought it was harmful, I would not have done that. So these are the kind of communication strategies that we use.
Thank you. Others who in the panel, would you like to provide commentary on the communication techniques you're using to either talk to your patients, clients, or general population of Washington?
I'm going to start by echoing much of what Dr. Kiss has just said. I think, for those who work in primary care, they have a fantastic superpower. It's really true. So I think building relationships and establishing trust is really where it's at. But as providers, we have to get, maybe more comfortable with the fact that although we have a lot of information that we think we have available and we want to share that information, um, we have to, as well as providing information, we have to take the step to be good listeners first. Because again, echoing Dr. Kiss, it's really hard for us to answer questions and to address fears without really understanding what the fears are for that family. And every family, every parent, every individual is going to be different. And so it's really critical for us before we weigh in and say, here's what you must do, to be quiet and reflectful and respectful, and to really explore concerns and the individual concerns for individual families, because they're not going to be the same. And there may be things that, again, as Dr. Giss has said, some of these things cannot really be addressed and dealt with in one visit. But by exploring together, by offering advice, by offering a listening ear, by suggesting other sources of advice, it's possible to come to a situation where parents feel that their concerns have been heard, their fears have been addressed, and they're able to move forward and make a decision that they feel is comfortable and right for them. And we as providers, I think, have a duty to try from the very get-go to show, to demonstrate, and certainly to say that we have a common interest. What we have in common is an interest in the health and welfare of their children. And the way to get children protected, the safest way to protect children from some of these terrible diseases that we don't see anymore, is to encourage vaccination as the safest way to protect children.
I'm going to put on my primary care physician hat for a moment there. And absolutely, when Dr. Kiss was talking about those conversations, that trust building exercise that all primary care physicians do with their patient population, it is invaluable. That's the only way that we can actually get the truth out there, and fight against a lot of the disinformation campaigns that's out there. I still, whenever I hear about primary care physicians finally breaking through to a family member that was really resistant with this concept, I think back in my own journey. It took me, I think my longest was 3 years of relationship building before finally the parent consent to that first immunization. And it was a huge win because I understood that if they have that experience and they notice, hey, all of my fears, all of my concerns actually did not come true right after this episode. That opens up the opportunities to talk about, the next high priority opportunity to protect their children. I think from a communication standpoint, now I'm going to switch hat on the carrier hat. We recognize how important that channel of communication is. And for us, it is less about recommending a specific treatment or vaccine. It is more about encouraging our members to show up to their primary care preventative visits, to have the conversation, to be able to discuss their health goals for both themselves, for their family members, and also to hear again, what is the current recommendation around, good health choices and medical decisions. When we talk about immunization, I know that we're focused on the pediatric immunizations, and oftentimes we hear about, the children are so resilient, they could tolerate the illness, et cetera, except for those that, really have a rough course, right? But also we need to think about, the family unit. What about the grandmother that, may be undergoing chemotherapy? What about the neighbor that's always greeting your children in the hallway that may be on immunosuppressants, right? So all of those are, to Dr. Kiss's point, we should bring up as how do we protect the vulnerable, both in your own family, but also in the community. So from a communication standpoint, we continue to try to encourage these interactions with our trusted professionals in the front lines of care delivery, and hopefully good will come out of it.
Thank you for that. Can you talk to either you or Jessica about, from the health plans, are you sending communication out to your clients, or how are you kind of communicating that to your client group? Because I believe you have the data from the health plan perspective on if your clients are becoming vaccinated or receiving immunizations or not.
I can speak to that first, and then Dr. Petzis, you can add on from your perspective. I think just globally at Molina, right, we know that members expect guidance from their providers, and so that's driven a lot of our communications with our providers and how we, work together to think about how we can promote vaccinations and access for vaccinations within our membership. We try to keep coverage clear, avoid competing interpretations, and then we really work with supporting our providers to have these trust-based conversations that all of the panelists have talked about already. I think when we're talking about direct communications with our members, typically we do offer communications throughout the year around well child visits, the importance of vaccinations, reminder cards. For this year, we're leading into that season right now. And so we're thinking through like what changes do we need to be making to the standard communications so that we're not just relying on the same messages we've used year to year, but potentially incorporating some of those messages that highlight that nothing has changed or that these vaccinations are still covered. And that's what we're working on right now is what changes to that messaging to our members is needed, and also what's the best avenue to get information to our members. We typically do a lot of mailings and text campaigns, and thinking through what needs to change with that, with the changing environment that we're in. Are there other ways to get this information out to our members in a way that builds trust and gives them confidence in where to go for vaccinations?
Oh, I can't get off mute. I'll echo what Jessica was just saying, and I think that drafting the message to the audience is very important. And for us, it is not just about the timing of the message, but also, is the targeted audience belonging to a specific ethnic group, cultural group? Do they have some sort of, hesitancy? For my community, for example, I see quite a number of Ukrainian refugees. And I think all of the medical community understands that there's been so much misinformation from their home country that this is a population that's rather difficult to outreach to. And how can we draft that message so that it is supportive, so that they can hear it, from people they trust, in addition to the healthcare the providers and their primary care physicians. Those are some of the things that we're strategizing to think about. How can we draft a message so it actually reaches the audience, right? Not just another piece of mail that they open up and put away without giving it a second thought. So those are some of the things that we're trying to be thoughtful about. What is the local community need from carriers with their messaging about, hey, you're due for your wellness visit, or hey, the flu season is up on us. This is an opportunity for you to receive the coverage, and we try to also outline the benefits that exist in their plans as well, to highlight that there's no cost to you if you do choose to receive the service. So those are elements in our member communication as well.
Thank you. And I want to bring Michelle in because so far we've talked about the direct individual communication or family communication. I would love to see if you have any comments on the public population health goal of educational campaigns.
Yeah, well, first, I just want to compliment everybody on the panel. And I know so many other providers and local health departments and other immunization champions. Like, you are out there doing the hard work every day, adjusting your communication skills, trying out different things to see what works. And I know this time is like adding confusion, and many of us, actually, health science, health communication science has showed, people will remember what they heard, that they heard something, but they won't remember what's right or wrong about it. So I think with so much more out there about immunization, that just adding kind of confusion, it's really hard, and families are bringing a lot more questions in. So we'll say in general, and I saw one of the questions in the box at the chat, the quick Q&A, do you have materials for this or that? We have a lot of materials out there for families and for providers. I put the link in, and things are rapidly changing. So if something different is needed, please let us know, because we want to help and make things there. Like the other panelists have said, vaccination is a health behavior, and that takes trust, and we're asking people to make a decision that's significant for their child. Most of this involves putting a needle in a needle in your baby's arms. And those of us that have been parents, that's just not without, a little bit of stress and worry. So we want families to be confident. We want them to, we all need to normalize that it's okay to have questions. Many people have questions about vaccination. And so can you invite conversation and still make a really strong recommendation? And to the point, I think it was some of the other panelists made, and in the chat box too, or the Q&A, just about, to not vaccinate is not a risk-free decision. And how do we all talk about what those risks? You're choosing a different set of risks when you don't vaccinate. And how do we make that really clear? Somebody in the Q&A had talked about the potential for school exclusion, which is happening right now in our state related to the measles cases here, which has a lot of impact on families too in a different way. So it's really hard for families and kids to step away and potentially be home for at least 21 days, potentially more, depending on how many multiple exposures there are in a school or work setting. So those are all things we need to do a good job of making clear. So we have materials at the department that does that, both that could be used directly with families or to help providers kind of think about how they're framing their conversations or what facts or figures they may want to bring up. So check out our materials and let us know if there's something else that's like coming up regularly and you need. I also want to say, and I think my fellow panelists hit on this too, but communication is really like a mile wide and a mile deep. So a mile wide, like, can people hear it a lot of different ways in a lot of different places? Are we talking about it such a broad landscape of partners who touch on the immunization landscape everywhere from your primary care to your health providers to your school? So are all of us as immunizations champions talking to all those places? But then the mile deep is really driven by, strategies for different populations and culturally significant populations, and who's the trusted messenger to have a more potentially detailed conversation, or think of unique needs with different families. And so that's really important too, as well. And I think that's all of us continuing to partner with community-based organizations, or thinking about, co-creating materials with those different populations and community-based organizations to really kind of do that mile deep and understand what's going to help somebody feel confident and build that confidence over time.
Thank you for that. And I just want to clarify too, if those on the call that didn't see the question that came in is, are there any harm reduction focused materials available for those families who choose not to vaccinate, so they can be aware of the risks or impacts that might occur, like school exclusions, if you choose not to vaccinate? And Michelle has shared a link to the DOH website. There's also another question that came in on what recommendations do you have for pediatric primary care practices who have seen an increase in missed well child checks due to families' concerns that vaccines are no longer covered? Are there particular resources specific to Washington that practices can share with these families?
Well, I'll say on our website as well that we do have a link trying to break down insurance coverage. Everybody hopes there's a super easy answer to this question. It's complicated by what plan you are and other things, but what we can say broadly right now, and you've heard from these health plans, but health plans have made a commitment to continue to cover immunizations for plans that are regulated by the Office of the Insurance Commissioner. That's an ongoing requirement. Medicaid is still covering full vaccination. So, it's hard to say always every plan's going to cover it every time, which is why there's always a message about check with your health plan. But we do have some information on insurance coverage. I could put it in the chat or others so people can see where it is. But broadly right now, very grateful for the continued commitment in our state and nationally for health plans to continue to cover vaccines. And that's been a national public commitment, and it's happening in our state. And then just trying to work on all the policy positions kind of behind the scenes. So I mentioned the state law that is just passed, waiting the governor's signature, that really ties health insurers in our state that are regulated by the Office of the Insurance Commissioner, which is not all health plans in our state, but tying that to recommendations from the department as well going forward for all populations.
Thank you. Dr. Kiss, you alluded to this and some others did on the call about we talked about side effects and having conversation about side effects. There is a side effect for not becoming vaccinated that we're seeing. As guidance from trusted sources continues to shift, we see outbreaks. Michelle, you highlighted measles is currently going on with the outbreak in Washington State as a result. What efforts are you taking to respond to these outbreaks and support patients and families during these moments of heightened concern?
Are you asking me?
You and any of the panelists can respond to
Couldn't
that.
hear who you were asking. This is the really worrisome part of our discussion today. We're already seeing outbreaks of preventable disease. Everybody's reading about measles, but our UW urgent cares just had, I think, 3 whooping cough cases in the last 2 weeks. It is just going to continue to increase as vaccine rates decline and community immunity starts to decrease. We're going to see more of this. And the real concern is you have your vulnerable who, even if you vaccinate on time, you're not protected if you get exposed. Whooping cough, a 2-month-old, is not protected with that first set of shots at 2 months. And if they get exposed by an adult with whooping cough, they will be extremely ill. So this is the concerning part, and I think this is going to continue to increase. A lot of parents with babies who are between 6 months and 12 months are asking about when do we get an early MMR, and there are pretty good recommendations around it, depending on the level of outbreak in your community or where you're traveling to. So trying to keep up to date with what the recommendations are. And then from the population health perspective, when Snohomish County reached a certain level of measles, we did send recommendations out for an early second MMR, which was recommended through MyChart, through text message. So doing outreach to families that could be affected by outbreak is another important thing to do. My biggest question as a practitioner is, when do our practicing guidelines change? High fever, when I started my training, could be meningitis, and you did more tests. And then we didn't see meningitis for 20 years, right? We just don't see it. And we handled fevers in a different way. But if you're unvaccinated and you're coming in with 105 fever, how are we now going to recommend? We're checking for bacteremia, doing blood cultures, seeing these children as opposed to waiting a few days and seeing if things improve. This is all changing. What about the sports physical? The boy wants to play football and he has no tetanus immunity, and he's going to play outside and get scrapes and who knows what. Am I still clearing him for sports? So these are really challenging, and I think recommendations are going to change as this evolves, but there's nothing set in stone yet that's telling us to change our practice.
Thanks for raising that. And I'm going to bring in Dr. Bell, who is an infectious disease clinician, to kind of add some commentary to this too.
Yeah, I've been thinking a lot about measles in the last 14 months and a lot about whooping cough for the last 2 or 3 years. And now I'm worried about polio. I think, again, this requires just a nuanced conversation with families. Dr. Kiss pointed out that a lot of people are just frightened. And they're not necessarily pushing back or being awkward or denying the obvious science. They're worried about what they've heard. So it's not helpful for us to heap fear upon fear, but it is absolutely an opportunity for us as providers, given that we have had the worst year for decades for measles last year with 2,000 cases, the first pediatric deaths in the United States for more than 20 years. And deaths last year in Washington State, we had a death from whooping cough. We know that whooping cough in the community means there are going to be deaths in young children. So we don't want to hang that axe over parents' heads, but it's an opportunity to say we're seeing more measles. This is not something that you as young parents will have seen because in the last few decades we have been extraordinarily protected. But as infectious diseases are increasing not just in the United States, but just with a loss of vaccine confidence and funding globally, we know that people who travel bring diseases back, and that it's a question of time, not if but when we see diseases being reintroduced to the United States. And if we live in communities where we know there are pockets of under-immunization, those communities are particularly at risk. But in truth, we're all at risk, and our best efforts to keep children safe and active and doing the things they need to do and being in school is to use the vaccines that are available to us. And the way we can reinforce that importance and use the outbreaks to our advantage is up to the individual provider and the family to do that in a balanced way that empowers parents to do what they, I think, probably feel is the right thing to do, but just to give them the confidence that they're making the right decision for their child and for their family or individuals for themselves. They need that confidence, and as healthcare providers, we just have to work at how the best way that we can encourage them to do that.
What emerging trends in vaccine development or policy do you anticipate will require proactive planning, or kind of what's the next thing that you're paying attention to?
Couldn't hear that question.
I can try to repeat. I'm sorry. Can you hear me? Okay, I'll get closer. I was saying, what emerging trends in vaccine development or policy do you anticipate will require proactive planning? What are you keeping your eye out for right now? Dr. Bell kind of alluded to polio, but I'm just curious if there's other changes in the system or specific illnesses.
I'll jump and have a go first. I think there are all manner of threats out there with the current administration. There are threats to the vaccine schedule. There are, as Dr. Kiss has alluded to, all kinds of insinuations about components of vaccines that might be contributing to long-term health problems or developmental problems in our youth. There are threats to the research community. Academic centers have had grants cut. We applauded the president with his rapid adoption of warp speed vaccines that I think saved millions of deaths across the world, and certainly hundreds of thousands of deaths in the United States with RNA vaccines. Now that funding for new RNA vaccines that might help to protect us against influenza. We talked about measles and whooping cough, but last year was a terrible year for influenza, the worst non-pandemic year. Almost 300 children died from influenza last year. We need better flu vaccines. So I think that, much of what I have enjoyed and been extraordinarily empowered by in my, many years of almost 40 years of practice is the fact that year on year we are doing a better job of developing vaccines, introducing vaccines, making vaccines affordable and accessible, until this last year when suddenly much of that has gone. It's not really new. We had enormous problems coming out of the COVID pandemic with a loss of trust, people feeling that they were promised things that were not delivered. And I think just a difficulty in understanding the careful balance required in making public health policy. All these areas are under threat. Many of the things that we relied upon as, not maybe necessarily relentless, reliable progress, but progress nevertheless, the institutions on which we have based our advancement are under threat. And mostly families are inundated with insinuation and poor advice and disinformation. I don't know that I'm really focusing much now, Emily, on opportunity as trying to deal with the next threat that comes along. But maybe that's a rather pessimistic view for now.
I want to share a little bit of, from the carrier perspective, what are some of the immediate, I think, potential threats, I would say, to vaccination rates, et cetera. One of the trends that we've been seeing across the care delivery network is resources are becoming more scarce. Cost of operation has increased substantially. And what I used to see, when I worked in the FQHC, we used to have vaccine clinics, we used to have after-hour clinics to offer that access, right, to the working family, to the parents that can't get to the clinic during business hours in order to complete the vaccination, even if they wanted to. My fear is that the cost of having these access points are going to be challenged in the next year or so. So are we still going to have these opportunities where, systems will dedicate the resources to staff the clinic, to have the providers available in order to deliver the vaccines even to the population that wants to receive it? So that's something that, I'm keeping an eye out for, hoping that the opportunity for the population to vaccinate continue to be offered. Of course, I think that, with some of the reduction in funding for the public or government lines of business when it comes to insurance plans, it's impacting our rural health care access and delivery substantially. So what's going to happen to those community when they want basic access, such as immunization and vaccinations? So there's a lot of questions out there, and I think that it's going to take a lot of partnership and solution-minded strategies in order for us to close those gaps.
And I'll just add on a bit to what Dr. Petz has said as well. I mean, in thinking about the trends that we see, and I know that there were a lot of great points already addressed just around navigating this landscape with vaccinations. I think we're already seeing less of our members engaging in vaccinations. I remember when we used to talk about the fear around the flu vaccine and that being like the one vaccination we couldn't count on members getting because there was just a lot of hesitancy around flu. And now that discussion has just like grown into just overall fear around vaccinations. And I mean, that's the biggest trend that we're seeing in terms of like our members. And I think that's the connecting thread around like why we're driven to think about how we communicate this information, how we work closely with providers and just try to be more, I don't want to say innovative because I don't know that vaccinations should be really like this innovative approach, but more intentional is probably the way to frame it. Really thinking about, as Dr. Petz has mentioned, like our rural communities, when we know that access is challenged, like access is a core part of our role as a payer. How do we navigate ensuring there is continued access in rural areas? And we're really paying close attention to how we communicate what's covered, how you access the vaccinations, how you can be confident that you're safe when you're accessing vaccinations, and really leaning into the trusted relationships. So I kind of think that was, all of the things that we've talked about contributed to like that's the trend that we see. And so how do we respond in seeing that? And I guess my worry is like, what is that going to continue to look like over the next year, as we know that like hesitancy is growing. And so yeah, I think that's the worry that I have and the trend that I think we see on the payer side right now.
The trend is palpable in clinic. I mean, when I started my practice, I had someone not want vaccines maybe once every 2 to 3 months. Then it became once a month. And then after COVID, it became once a week. And now it's twice a day. And the real trend that I'm seeing that's worrying, it's not just saying, well, I'll do all of them, but I don't want MMR. Now I am seeing a 2-month-old, 4-month-old, 6-month-old zero vaccines, completely unprotected infants, which I have not seen this in 30 years of practice. And this is what I see increasing. And I find this terrifying because there will be a bad outcome. And I don't want to sound pessimistic, but as immunity rates decline, we're going to have some bad things happen. And that may be what changes the conversation.
Michelle, thank you for all this. I want to ask you a question. We're talking about fear and different things changing. In Washington State, some vaccine vials are supplied directly by the CDC. As recommendations are continuing to evolve, what potential supply chain challenges is the Department of Health anticipating, and what strategies or workarounds are being considered to ensure continued access to vaccines?
Yeah, there is lots of contingency plans happening, and I appreciate everything the other panelists have shared so far. I think there's significant risks on every aspect of kind of the vaccination continuum, from research and development to licensure to recommendations to what's happening in with access and in primary care and other points of access to kind of the policy end as well. So I'll do a quick primer on how vaccine supply works in Washington State, starting kind of with children. And I mentioned earlier, the state buys all recommended vaccines for all kids with a combination of federal and state funding, with most of that state coming from health plans through the Washington Vaccine Association. And we buy that way because we're able to buy in bulk, and we purchase off the CDC contracts to be able to do that. I'll say right now, despite the massive disruption in recommendations and the confusions, there's been no changes to access as far as vaccine purchase. All vaccines are recommended still, no matter what type of recommendation they have from the federal level. We can purchase them all off those CDC contracts for all children. In the end, all of the vaccines could be given, in consultation with a provider to anyone who chooses to get them, even off the federal recommendations. So the system, besides the disruption and confusion in messaging for parents and providers, there's nothing that's really changed, but we are doing planning about what would happen and where would we purchase vaccines, and how would we pay for them if there was a change in either how we could purchase them or what's on what's truly a VFC recommendation. So that's the way vaccines are covered for about 50% of the populations through the federal Vaccines for Children, or VFC program, and that money is actually money that the state is awarded, but sits at CDC. So it's like a little bit complicated on the back end about how we're using all these different funding sources to hopefully make it easy for parents and providers to have vaccines and to choose to be vaccinated. So we're just working on contingency plans around funding, contingency plans about how we could buy. And I think one of my bigger worries is all that's still kind of happening, but I really worry kind of about the front end too, about research and development. Dr. Bell already mentioned the need for better flu vaccines. I think all of us were probably watching with bated breath or a lot of frustration about what happened over the last couple of weeks or last month with mRNA flu vaccine and what was happening at the FDA level. Like, if we see it's changing the risk ratio or the risk scenario for vaccine manufacturers to invest in research and development to bring new products to market. And obviously, if we have some type of recommendation or other ways, we could figure out other ways to purchase vaccines. But if we don't have a vaccine license from the FDA, there's not really policy solutions that the state or any state can work around. Like vaccines are a federal vaccine licensure is kind of a responsibility of the federal government, and all of us have to need to supply medications and drugs that are licensed at the federal level. So So that's kind of my bigger worry, like what happens and what are our avenues if something were to happen with FDA licensure that would significantly change our impact. And I think that's where legal strategies or other things continue to come in. And obviously, I think everybody knows we continue to work really closely with our Attorney General's office as state. And I know we're seeing actually, leadership from other organizations like National AAP in some lawsuits they're leading around changes to the childhood schedule. But obviously, that's going to be something we all continue to need to consider as states and agencies about if there's a legal strategy that should be pursued depending on what changes are happening as well.
Thank you for that and answering that.
Can I just add, the
Yeah.
contingency plans are all one thing, but it's really hard to predict what's coming next. But all that we know is that this is not the end of the show. So, a year ago, we had removal of recommendations for COVID vaccines for children and for pregnant people, followed by insinuations about the need or otherwise for a universal birth dose of hepatitis B. And the assault has continued, such that now, a third of our routine vaccines are no longer recommended. So it's very clear that the Secretary of Health and Human Services has appointed people at all levels in the infrastructure from the NIH to the FDA to undermine vaccines and to undermine the efforts and the institutions that have been built up over time. I'm worried about the Vaccine Injury Compensation Program. I think if autism were to be added to the list of compensatable conditions, then our funding for vaccines would completely collapse. Industry would be driven away. But we do what we can. I think that it's really important for us who are in the vaccine space and who work with patients to speak up for vaccines and to promote the success we've had and to sit back and explore the joy of immunizations and to celebrate the success we've had, but really to motivate people to continue to fight for what we know is an essential health resource.
Thank you. There's a couple questions in the chat that I'd like to get to. Michelle, there's a question that says, is there any work on to make the use of COEs more restrictive in order to encourage more school age vaccinations? So a certificate of exemption.
Yes, there's certificate of exemption for people who don't know. What's on the certificate of exemption is really driven by what's in state law. So we don't really have authority to make changes to how the exemption policy and process happens without a change in state law. And it would require some type of public process to do that. So there's not any immediate changes right there. I think it's really important. I think a lot of this happens at the provider level, as we've already talked about families understanding the risks from choosing not to vaccinate and the risk, especially in the school setting. So we do have materials and information available related to that. But if people have more ideas, I'm happy to have a further conversation. But right now, the department is not policymakers, we're policy implementers. And so we really have to follow the state laws as written and passed.
Dr. Bell, do you have a quick answer to that?
I just want to make a contribution to say that although the requirements for school entry are really important, and we know that there is great data to suggest that where school exemptions are small and limited, that vaccine coverage is improved and that outbreaks are less common. But I think in 2026, it's a double-edged sword, and that if we are seen to be enforcing and mandating, that's not going to work to our advantage. So much of what has come out of the COVID pandemic is a loss of trust in authority, a feeling that individuals at the top are not looking after the little people. And I think there was a great deal, much of the lack of confidence that allowed the appointment of our current health secretary was driven by coming out of COVID and the feeling that people did not have the confidence in recommendations, and certainly a very profound resentment of any sense that we are mandating anything, much less mandating vaccines for children. So, we would love to use the school requirements as a way of encouraging people to do what they feel to be the right thing. But I think we have to be very wary about a heavy-handed approach that may hurt us rather than help us.
Yeah, I'll just say I couldn't agree more. So I think it's important. And we talk a lot about within the public health system and at the State Department of Health about one of our main prior things we need to be doing is focusing on rebuilding trust. And obviously, I couldn't agree more with Dr. Bell that mandates should really come in a time of high trust. And that's not where we're at, and we should focus there first.
Thank you. We're getting near time, so before I ask the last question, I just want to let people know if you're on the call and wouldn't mind filling out our post survey to give us feedback on your experience. But also, if you're enjoying the conversation today and you're working in immunizations, we invite you to join us at the Washington State Immunization Summit happening on March 19th. There's a virtual option and an in-person option in Tacoma. There's a link in your chat right now that you can look that up. And we have another event from Bree coming up that we invite you to. But we're going to round out the conversation today, and sorry, I forgot to, is our sister program, Washington Patient Safety Coalition, is going to be working on vaccines. And so you'll see some more information from our organization on that in the upcoming months. So if you have questions on that, let us know and contact us, and we can get you in connection with Washington Patient Safety Coalition on this topic. But I would like to ask our panelists as we wrap up, if participants take away one action or mindset from today's conversation, what would you want it to be? And I'll start with Dr. Petsas.
I think one thing, if I want our audience to take away, is that I think across the healthcare ecosystem, there is alignment that is based in evidence and consistency with clinical recommendations. So in your capacities, communicate to our communities in Washington to engage their primary care providers, the physicians in their lives, and the providers in their lives to really talk about and review their concerns. The other thing I wanted to kind of echo is what Dr. Bell and Michelle had highlighted about the mandate is not the way to go. There has been a lot of frustrations and fatigue amongst our frontline care delivery teams. I would say the providers, the physicians, they have been having these conversations for so long. Oftentimes, we need to remind them that empathy will carry the message further than if we just, say, you don't know what you're talking about. So those conversations needs to continue in order for us to bring the populations that's straying away from evidence-based practices and evidence-based recommendations closer so that we can achieve better outcomes.
Jessica?
Yeah, so I think the one thing I would want folks to take away from today is trust is important. I think we've talked about it throughout the whole webinar. Families and people who are thinking about vaccinations and are hesitant around vaccinations want to be able to trust the process, I think, or need to feel that trust. There are, so many reasons why someone is hesitant around a vaccination. And I couldn't agree more with Dr. Petsis of really wanting to encourage families as much as possible to engage with their primary care provider so that they can have their questions answered, engage in conversation, but knowing that it's a really challenging time. So I think trust is key. Rebuilding trust is a really important priority, I think, across the system right now, but also just being intentional about how we communicate with, at least for us, how we communicate with our members, how we share messages that inspire trust and also connect our members to trusted sources for information. And I think that's why it's so important for me to always encourage people to connect with their provider, because that's who they should go to when they have questions about vaccinations or really anything around the health of themselves or their children.
Thank you. Dr. Bell?
I'll try and be quick. I think it's really important that we encourage everyone to pay attention to what's happening and to be aware and speak up. It's very easy to say, oh, well, COVID vaccine is no longer recommended for children, but we can get them. Oh, universal birth, hepatitis not recommended, but you can still get it. But these are creeping changes that destroy the values that we know as health workers are really important. So vaccines have been extraordinary successes for the last 120 years or so. We need to speak up when we see the threats to these vaccines and empower parents and empower families and empower ourselves as providers to speak up with a loud voice.
Dr. Kiss?
I would say vaccines are modern day miracles, and they work so well that people start to wonder if they're still needed. Most people haven't seen these diseases that they prevent, and therefore they don't fear them. The tide is turning. We're starting to see these diseases again, and these diseases are pretty awful. And misinformation and fake news, it sows doubt and fear. And families who don't vaccinate, they love their children. They're trying to make the best decision for their children. They're not bad parents. So our role in healthcare is they come with stories of fear about damage from vaccines and danger from vaccines. And I think our job is to share stories about protection from diseases. So all we can do is continue to connect, continue to build trust, and be there for their children.
Thank you. Michelle?
It's hard to follow up on all my co-panelists, but I'll just say that it's really important to know vaccines are still our best protection against so many dangerous diseases. They're available in Washington with no changes to recommendations and no changes to insurance coverage. We know it's a highly dynamic environment. There's lots of resources and materials, and we're all working hard to hear what as needs continue to change. So check out what resources the department has available and let us know if there's something else you need. And lastly, I'll say the public is still very supportive of vaccination, even with some decreasing immunization rates. Most people are choosing to vaccinate their family, and public opinion polls in red and blue states are showing incredibly high support for vaccines. So if you need a booster, go check out some of those public opinion polls. The Kaiser Family Foundation has started listing all those polls happening across the country. And it's really, really reassuring to see very, very high rates of support for vaccination, like into these in 80s and 90s happening in every poll that's happening. So if you need a pick me up, you can find it. And we are doing the work for our communities that is really crucial to keeping our communities healthy and safe. And I know it's not easy and it's getting harder by the day, but we are in it together. And to know how thankful people are for the work we're all continuing to do, whether it's AAP still putting out immunization schedules, all the thank yous we've gotten for the work around the West Coast Health Alliance, all the creativity from providers thinking about their messaging or trying different approaches. I just think we live in a state in an area that has strong support for science, and we're having a lot of forward progress despite the challenges that we're facing. So we look forward to staying in it together.
Michelle, I have one quick response. Is you were saying let people know, let you know if they need anything. How do they let you know?
We are going to put, or can one of the DOH staff, or actually, I'll put it here in chat, or if you go to, actually, we've already put in chat our DOH address, our website. There is information about how you can email us. So, and we can follow up too with a follow up. But anybody is welcome to email us anytime to say this is happening or this is like something else I could use some additional support on. We need to know what's happening on the ground so we can continue to adjust our approaches as well.
Thank you. And I'll work on sending that out after this too. And I'll connect with
you
you on that. Thank you everybody for joining us today. And thanks for staying on a little extra, joining this conversation. We hope to continue this conversation with you at the Washington State Immunization Summit and also with our Washington Patient Safety Coalition. So thank you everyone. And thank you so much to our speakers for joining us and sharing your time, knowledge, and expertise. We hope everyone has a great day, and we look forward to seeing you all in the future. Thank you.